Okay, let's admit it. We all spend way more time on our phones and laptops than we want to admit. And as a result, dry eye disease is becoming more prevalent. Age is also an issue. Dr. Joaquin de Rojas is a cataract and lens replacement surgeon with the Center for Sight. He is also a dry eye specialist, and he is here to talk to us about different dry eye treatments. Thanks for joining us.
Thanks, Stephanie, for having me.
I feel like this is one of these inevitable things as we age, so it's good for us to put it out there in terms of dry eye disease. Explain how it happens and what happens when this starts to feel funny.
Yeah, so dry eye is an interesting disease because it's very multifactorial. A lot of different things can cause dry eye, and it also presents in many different and interesting ways. It can be a mimicker of conditions because people may come in thinking they need surgery for their cataracts, and meanwhile really what they're having is an issue with their tear film, which is the tears as they cover the cornea, the surface of the eye.
Yes, talk to us about this graphic because it's fascinating that there's so many different parts of a tear film.
Yeah, this is a nice graphic because it outlines the layers of the tears, and when you think about dry eye and how it's a pathophysiology, and when you think about treatments for it, it's nice to go back to this chart. You have the cornea, which is, if you were to touch your eye, that's the clear layer on the surface of your eye, the first window into your eye, into your vision. And on you have the layer there, and then you have this mucin, this mucus layer that kind of attaches to the cornea and is a scaffold for the rest of your tears. The tears go over the cornea as you blink. So after that, you have that mucus scaffold, you have the aqueous, which is just basically the fluid layer, and after that you have the fat layer, the lipid, which prevents the tears from evaporating.
So how do you determine which of the layers is a problem in each patient?
So when you're thinking about the mucin layer, that layer is very important, and when you have patients who have had LASIK, or you have patients that have autoimmune conditions, sometimes their goblet cells, which are special cells that produce this layer, can be deficient. You can do this with different dyes. When we examine you at the slit lamp, that little light beam that you see when you're with the ophthalmologist. So we can kind of tell if there's a mucin issue. Aqueous is really tear production, so it's patients that feel like they're dry, they don't tear as much, and you can tell this literally. You can use stains, you can see the layer, how much width of the tear film there is, and you can see how much, you can actually measure production in the eye and see is there enough production that's being made of tears, and that's produced in the lacrimal glands. And then finally you have the lipid layer, and those glands are found in the eyelids. So patients with eyelid conditions like blepharitis, like meibomian gland dysfunction, even floppy eyelids, I can talk about these, but all these conditions, what they can do is they reduce the amount of oil production from these meibomian glands that are located at the eyelid margin. And then what happens with those patients, they'll complain that their vision fluctuates a lot. You know, they blink, it gets better because they're having enough tear production, but it's just evaporating too fast. And what we actually see in most of the time is patients have some combination of these things between eyelid conditions and aqueous deficiency. So it's up to us to figure out, you know, what combination of factors is leading to their issue and what's the best way to handle that and to get them better.
And in terms of treatments, I know IPL is a cutting edge and treatment that you're using at Center for Sight. Explain how that works.
IPL was first used in dermatology, and it's been used for a lot of conditions to reduce scarring, to vessel formation. What we found is there's a condition called ocular rosacea. Essentially, it's an inflammatory condition of the eyelids, and you have these little blood vessels that bring all this inflammation to the eye. So this treatment, what it tries to do is it uses light treatment in the spectrum of like 500 to 1200 nanometers, so basically intense light. And what that does is it creates a kind of chemical reaction that kills these bad blood vessels, thereby preventing more inflammation to the eye and also improving the oil production that we were talking about. So that can be really helpful. And I've seen patients with, you know, it could be one treatment, it could be 3 treatments, have really long-term improvement, you know, from IPL.
That's great. And it's funny how inflammation is always the bad word for everything that's wrong with our whole body, and now we know it includes our eyes as well.
Yes.
For anybody at home, what are the symptoms that should cause us to consult our ophthalmologist and Center for Sight? What should concern us in terms of dry eye?
Yeah, so I would say if you're having a lot of visual fluctuation, that's a big one. So it's one thing to feel like your vision has gotten worse and you need reading glasses. We do a lot of treatments for that too. Or you have issues, just your vision's just getting worse, glare, halos. Some of that stuff can mix in with dry eye. So glare and halos, light sensitivity can be caused by dry eye. As can, like I said, the vision just seems to change as you blink. It fluctuates. As can foreign body sensation. As can just general blurriness or feeling like the eyes are goopy in the morning and there's stuff coming out.
And
that can be as well.
The test for this, as you mentioned, not stressful, not painful. It's simply drops and lights, right? So no one should be concerned about being tested.
No, testing is the easy part. We get you in there. We might put a little drop in there just to see how the pattern of that tear film is coming across your eye. We might press on your eyelids to see how those oil glands are doing. And then from that, we'll decide maybe IPL is good. Maybe we'll make some in-house drops made out of PRP. We have a lot of different treatments, both available like at pharmacies, over the counter and not, and even things we do in-house. And again, that's a customized approach.
So the takeaway is certainly it's not something you have to be scared of in terms of treatment. The Center for Sight definitely has lots of different options. And if you are having any dry eye concerns or any other problems with your vision, you can find them by going to centerforsight.net.